Welcome to our new season of Beyond the Stethoscope, where we explore the people, practices, and innovations shaping the future of healthcare in Greater Philadelphia and Northern Delaware. I'm content marketing specialist Sam Bambino, filling in for our host Adrian Kiss. As backpacks come out of storage and school bells start ringing, it's the perfect time to talk about one of the most important parts of back to school prep, your child's health. In this episode, we're joined by St. Francis Hospital Center of Hope primary care physician, Dr. Sergio Ramirez, to talk about everything from physicals and immunizations to mental health and healthy routines. Whether you're a parent, caregiver, or educator, the conversation will help you set the stage for a healthy, successful school year. Hi, Dr. Ramirez. Thanks so much for joining us today. How are you?
I'm doing well. Thank you for having me.
Of course. To start, can you just introduce yourself and talk a little bit about your role at St. Francis?
Sure. So I am a primary care physician. I work at an outpatient clinic, which is part of St. Francis, that is Center of Hope. And there we see everyone from newborns up until the elderly, including women's care.
Very nice. So we are very close to the start of the school year. Can you believe it? What are some of the most important health check-ins and screenings that parents or guardians should keep in mind for their children?
So some of the things to prioritize are the annual well child checks, because this is a visit that helps us, gives us the opportunity to assess the child's overall health, check in on their developmental milestones, update vaccines, as well as complete any school-related forms.
Okay. Why would you say that this time of year, the back to school season, is such a critical time for these check-ins and appointments?
I think it's an important time because it gives us the opportunity to identify any potential health issues that might negatively impact the child's academic performance. So this includes anything that might be physical, mental, or emotional.
During these appointments, are there specific immunizations, vaccines that you recommend, and does that vary by grade or age group?
Yes, so the recommended vaccines vary depending on the child's age. Some of the important ones are those against tetanus, whooping cough, measles, which we've seen have been making a comeback, as well as bacterial meningitis.
And you mentioned that you look for different physical, emotional, just indicators in these children. What are some things that you look for regarding those things?
So we see we do screenings for anxiety and depression, as well as a variety of questionnaires to see that the patient is meeting their developmental milestones.
And if, you did find that a child was, suffering from anxiety or something like that, would you come up with a care plan after that, or what would happen afterwards?
Yes, absolutely. So we would try to identify what may be the root of the issue, and then plan along with parents or caretakers to come up with a game plan, and even get other specialists involved to help with the care.
So now the back to school season, it can just be stressful in general for parents and kids alike, How does your team support the emotional well-being of your young patients?
So we help by addressing any parent or patient concerns, as well as providing information about the child's development, what to expect. And also we encourage an open dialogue between the child, the parents, teachers, and their medical provider, so that there's a sense of trust, and so that hopefully that helps facilitate the discussion of any questions or concerns that may arise.
Sure. Now, for any child who may be diagnosed with something anywhere from asthma, diabetes, ADHD, and, anxiety again, is there anything that parents can be doing in those days or weeks leading up to that first day of school to kind of set their child up for success in the classroom?
It's very important that the parents and anyone else involved in the child's care is as educated as possible in the condition, so that they can work together to optimize the child's care plan. So this includes being informed about special accommodations, medications, triggers, and importantly, when to seek emergency help.
Can you talk a little bit about the education that St. Francis provides parents who come?
So at every time that there is a well child visit, we always provide information regarding the development, where the child stands as far as their growth, as far as their milestones, and what to expect in the upcoming future. So that way that both the parent and the child are informed, and they may not be as scared of certain changes or certain things that might come up.
Sure. And for parents or guardians who are taking their kids to their back to school primary visit, how can they make the most out of that visit? Is there anything they should be asking or?
Yeah, so it's important to come up with questions or any concerns. Talk to the child before coming in, see if there's anything that they would like to discuss in particular, and also bring any medical records that you may have, vaccine records, as well as any forms that the school will be requiring, so that way we can tie everything together at that visit.
Okay. Was there anything additional that you wanted to add in on this topic?
Oh, that we are at St. Francis. We're always happy to welcome new patients. Like I mentioned, we see everyone from newborns up to the elderly. We also do women's care. So we're pretty well rounded, and we'll take care of the whole family.
Great. Well, thank you so much for joining us today, Dr. Ramirez.
Thank you for having me.
As we've heard today, back to school season isn't just about pencils and planners. It's about making sure kids are physically, mentally, and emotionally ready to thrive. From routine checkups to building healthy habits, primary care plays a vital role in setting students up for success. For more back to school health tips or to schedule an appointment with Dr. Ramirez, please visit the link in the description. Thanks for tuning in to Beyond the Stethoscope. Don't forget to subscribe and follow Trinity Health Mid-Atlantic on social media for new episodes every other Thursday.